Welcome to our Congress reporting from ASCO. That is the Congress, one of the largest congresses of the American Society of Clinical Oncology. And we're reporting for our patients today, from patients today and Mamma Mia, on advanced breast cancer. And I'm very happy and delighted to welcome Professor Nadia Harbeck, who is presenting the studies that we found the most relevant from the newest news from ASCO, and we shortly discuss them afterwards. So welcome aboard, Professor Harbeck.
Yeah, thank you for having me. And this is now about triple negative disease. And we just took one study, which was also presented in a special session in the oral presentations, looking at triple negative disease and the first line therapy. It's called Ascent 04 study, and it took patients with triple negative disease and no prior treatment in the metastatic setting, a PD-L1 positive tumors, that these are highly immunogenic tumors with the combined positive score of 10 or greater. And the question was whether the standard of care chemotherapy plus pembrolizumab is less effective than a new therapy with an antibody drug conjugate, sacituzumab govitecan plus pembrolizumab. We know sacituzumab govitecan already from the second line, is our second line standard without immunotherapy. And the question is now, can we move this one line further upfront if we combine it with immunotherapy in those tumors that need immunotherapy? And the question is quite reasonable because we know that these ADCs outperform chemo. So the question is whether if we combine them with immunotherapy, they also outperform chemotherapy. Primary endpoint is progression-free survival by an independent central review. And then we have all the usual secondary endpoints and safety endpoints. And make a long story short, the study showed quite impressively that sacituzumab plus immunotherapy is better than chemotherapy plus immunotherapy, pembrolizumab being the immunotherapy in this case, with 11.2 versus 7.8 months and a hazard ratio of 0.65, highly significant p-value. And also the median duration of response is substantially longer with the antibody drug conjugate in pembrolizumab. So here's the median PFS, and we can see that the curve split early, and there's quite a durable effect favoring sacituzumab plus pembrolizumab. If we look at the side effects, there's really nothing that we didn't expect. We know side effects of chemo, we know side effects of sacituzumab, and we know side effects of immunotherapy. But interestingly, dose reductions and therapy discontinuations were less with the antibody drug conjugate. So in conclusion, sacituzumab plus pembrolizumab in the first line setting leads to longer responses, better PFS, and has a good tolerability. So my take-home message would be that this could be a new first-line standard, provided that there is a approval extension. Both drugs, sacituzumab and pembrolizumab, are approved in triple negative, but not together in the first-line setting. So there needs to be some regulatory approval, and then we can use this for our patients.
Well, thank you very much. And as you said, because each is already approved separately, it hopefully doesn't take too long to approve them together. And it's a very great alternative to chemotherapy. And I think this is probably the way forward, that we are more and more alternatives. And I'm especially happy because for triple negative breast cancer, we always have less options than for the other indications. And yeah, I look forward to more studies on this, and let's see where it all leads to. That is excellent news. Thank you very much.
Thank you.
Yeah, that was our take on triple negative breast cancer from the ASCO. And on behalf of patients today and Mamma Mia, I thank Professor Harbeck for her time and her patience to explain this all to us. That I almost have no questions to you because you always explain that everything so nicely. Thank you.